Hello, I am Kate Warren, Executive Vice President at Devex, and delighted to welcome to our virtual P4P stage Laura Murray, who's a senior scientist at the Johns Hopkins Bloomberg School of Public Health, to discuss how technology can help make advances in mental health. So Laura, thank you so much for joining us.
Wonderful to be here. Thank you.
Great. So, one of the many side effects of the COVID-19 pandemic has been the extreme mental health toll it has taken really on all aspects of society. I think you could say that the pandemic has really been a dual crisis, with mental health being the other side of that coin. Many mental health indicators around the world show sharp increases in depression, anxiety, suicidal ideation, particularly among youth and even healthcare providers, as they are trying to care for others and themselves. And I think it's revealed just how inadequate our systems are for providing mental health support and services, particularly in lower middle income countries. So Laura, from your perspective, in what ways has the COVID-19 pandemic uncovered the need for really reshaping mental health approaches, particularly in lower middle income countries? And how can mental health care in low income settings be made more efficient, more effective? And what's the role of technology in all of that?
Well, you are so right, Kate, that COVID-19 certainly did shine a light on the high need for mental health services and really the lack of supply globally and domestically. I think in reality, we've known for a while that our mental health system in high income countries is pretty broken. And of course, in LMICs, often non existent. I think COVID has highlighted three challenges that can really bring opportunities for innovation. Just to walk through those, the first one being ineffective care, the second one being an unsustainable approach, and then the third one being the lack of spending any real resources on mental health. So just to walk through those one by one and talk about those opportunities that we have for innovation and whatnot to address those challenges that COVID has rose to the top. The first reshape, I think, is that focus on evidence-based. So just looking historically, we actually have an education crisis in mental health. In the early 2000s, our Surgeon General here in the United States talked about how these evidence-based treatments that have been well studied actually are not available to most licensed providers. So even workforces in high-income countries are rarely trained in them. And of course, in LMICs, it's even worse. Most of what is still done is untested psychosocial programming. Our funder USAID and the mental health advisor there, who's a doctor, talks a lot about quality control in drugs, right? And how much we put into that. And quality control in mental health really relies on using these types of effective treatments and making sure that providers are trained well. So that's sort of a first way that we can tackle more effective, efficient care. The second I talked about is an unsustainable approach. And here we have huge opportunities to innovate and reshape. So evidence-based protocols in mental health actually address one problem at a time, usually within one age group, right? So in LMICs, you see programs just for parenting skills. And then you might see a different program for just depression, but only to tackle that with adults. Some models have moved into, for example, depression and anxiety, still separated by age. So this is really an unsustainable approach, and it's actually seen in high-income countries too. But let's say I wanted to build out a mental health system in Namibia or Ethiopia. I would have to build, implement, train, scale, and sustain 8 to 10 of these different evidence-based protocols, huge workforce, just to address a handful of common mental health disorders. So our current approach really should give us pause to say, what's a different way to do this? So tackling multiple problems with one approach that can span across the age is really something that USAID has been innovatively focused on funding our group to figure out how we can do this more efficiently, more cost effective, and really to treat a person more holistically. In my many years of work in this field, I've never seen anyone come in with just one problem.
Yeah.
The third The third point, just to wrap it up, is I talked about sort of no real resources going into mental health. And I think that's something that COVID has raised to light too. COVID has given us just incredible awareness, and people are more interested in it, but very unfamiliar with it. Last year, NIH held a large global mental health conference without borders, and leaders from all around the world came. And one of the big summaries was we have to understand the impact of implementing and integrating these mental health systems and sort of stop treating mental health as a side program or an add-on. We see a lot of people saying, well, let's give a small amount of money for 1 year, just do a training, and then we can say we've integrated mental health. So really thinking more strategic about how do we integrate into different healthcare systems, treat coexisting conditions, enhance that continuity of care, and reduce costs. So much more efficient and cost effective.
Yeah, and here today at Prescription for Progress, we're really talking about partnership with the tech sector. So how do you see that and the role that the tech sector can play, and the role of partnership in addressing even some of these funding and resourcing gaps that you recognized?
I think there's a lot of opportunities. One is I think that the technology can bring us up to speed in different areas of how do we do this different? How do we really think out of the box? So I think they can really play a large role. I think private-public partnerships are something that's really going to be needed in the future because of that resource issue with mental health. And then I would say a third thing is that really working with technology to understand what are the pros and cons, and what do we really need to do in different contexts and settings to make this edible for populations, accessible, but also doable. I mean, many places in low and middle income countries don't have electricity, plugging in phones doesn't work. They don't have money for talk time or for SIM cards. So you're dealing with a different level of technology. And I think that's really where that partnership is so important for connecting people who understand these contexts and settings, along with the brilliant technology brains.
Yeah, and you talk about the pros and cons of technology, and as we expand more digital connectivity, there's a lot of opportunity, right? You look at telehealth and other ways of scaling access to mental health. But we also know that increased access to technology can lead to mental health challenges. We've seen through particularly the pandemic, particularly teenage girls, skyrocketing in rates of anxiety, depression, suicidal ideation, really linked back to increased use of social media. So I'd love to hear what you think about how to balance the pros and cons of technology, and making sure that we're leveraging the good parts of it, but also recognizing some of the ways it can contribute to mental health challenges.
I'm so glad you raised this, Kate. I think in our desire to reach more people and get more access, we've really gone down that technology road. I see a lot of situations where providers, healthcare workers aren't really involved in that, and there's not a whole lot of attention paid to some of the different circumstances and issues with that, and some of the response from the populations that we're working with. So one, I think just really being collaborative, having a very multidisciplinary team, and making sure that we're not so excited about technology that we don't understand those pros and cons. I think that while technology may be ideal for scaling, for example, getting information out there, or people with a lower need for mental health care, can really go very far. If I'm somewhat motivated, if I don't have very severe depression, or I'm not in an IPV situation, interpersonal violence situation, those things can be really helpful. There are times where we're finding that more intensive face-to-face is needed. So finding the right mix of technology versus in-person, and being very flexible with that, is really something that we need to study and look at a little bit more.
Great. Well, thank you so much, Lara. And I know we can continue this conversation later in the breakout sessions. And if anybody wants to connect with Lara or chat with her further about this, I know she'll be joining us in our breakout session on technology and innovation and the COVID-19 response. So a lot more to dig into here. But in the meantime, thank you, Lara, for your time today.
Thank you.